Welcome to iHeart Radio's CEO Unplugged. I'm Joe Bartlett. Our guest today is one of the top dentists in New Jersey. Actually, for the last 8 years running, a top dentist in New Jersey, Dr. David Jin. He owns A Beautiful Smile Dentistry with offices in Fort Lee, New Jersey. Dr. Jin, you have a great resume. Former Navy dentist, started as an oral surgeon, and now specialized in cosmetic and restorative care. So you must really like what you do.
Thank you, Joe. Yes, I love what I'm doing. I enjoy doing all different aspects of dentistry, and Navy actually offered that opportunity for me to learn different aspects of dentistry. It's like MacGyver. MacGyver get to learn to do everything, and he put everything together and to bring out what is the best in the industry.
Now, when you're a Navy dentist, do you kind of churn these guys through a little faster than you would if you had a private practice?
Well, in the Navy, you actually have the tons of time and tons of money because our budget is unlimited and we get to do anything, everything we want. And as long as you're willing to, there would be some guidance there for you to teach you and coach you along the way to give you what is best for you. Time is unlimited, money is unlimited. That is the best way of practice.
I got to tell you, dentistry is so good these days. I mean, it really is very, very sophisticated. There's no reason anyone should not have a perfect smile.
You're absolutely right. Everybody should have a perfect smile. I think the biggest challenge is to get the patient really get into the office to really get to understand how important dentistry it is to them.
Obviously, one of the biggest impediments would be pain.
Well, pain is many different aspects, right? I basically like to think pain into 3 different aspects. One is the actual physiological pain. That's most of the time when patients actually do come in. And that's the last moment you want to come in because when you come in with pain, usually you're in deepest trouble. So you want to actually come in when you have no pain and just make sure everything's doing right. Now, the second aspect of pain is pain in terms of emotional, psychological. You come to a dentist and you look at it and you say, ooh, this guy must be hurt. Well, with modern technology, we don't hurt patients. You could ask most of my patients. When I give them needle, they look at my hands and say, did you get me numb already?
Wow.
They feeling it, but yet they didn't know I did get them numb. And that's a skill. And that's a skill set that you gain from experience and everything. Now, the third aspect of pain is, of course, the financial aspect. Well, we trying to help you. When we dive into different aspects of dentistry and how can we do and work with you, and we trying to help you along to ease that financial pain. Everything is expensive nowadays. And, you got to at least visit a dentist and let them coach you along the way and to see what is the best solution for you.
Well, sadly, I think a lot of people don't go to the dentist until they really have a problem, until they're in pain or they're in distress or where they need major work. What's your advice to people out there? What would you say to them to get them in now before they are in distress?
Well, absolutely. Most of them come in when they are in pain, right? But the truth of the matter is we're given a set of teeth that should be functional, that should be cavity-free. And it's just like a car, a piece of machinery or anything like that. I hate to equate teeth with machines. But truth of the matter is your chewing machine. Now, the better you take care of it, the better off you are with this machine. So that machine needs oil. That machine needs lubrication. That machine needs to be checked. And that also machine needs to be well taken care of. And that's where dentists come in. Dentists come in, we're the doctors. We're the doctors of your body. We're the doctors of your teeth. And when we come in and we work on you, we got to understand your body first. Then we could figure out how to work with your teeth. And once we're able to figure out how to work with your teeth and help you optimize that machine that's able to eat, chew, and function and make you enjoy your life.
Well, I'm sure a lot of your work is a lot more than cavities. I mean, that's just the simple thing when it comes to dentistry. I think in your specialty now is cosmetic dentistry. So I think from what I understand, the biggest thing in dentistry right now is implants, right? Everybody's doing implants.
Absolutely. Well, implant-wise, this is what I call a third set of teeth. We're given 2 sets of teeth in our life, most of us at least. Implant is what I call the third set of teeth that we give to ourselves. Although implant is not always the best solution for anything, but a lot of time implant is one of the optimal choice versus dentures. And a lot of time we use implants as a means so this way you don't have to have anything that's taken out of your mouth or anything embarrassing moment.
In terms of dentures versus the implants, obviously the implants are permanent. They're not going to they're not moving anywhere. What's the cost difference between dentures and the implants? And would it make sense for somebody to have dentures versus implants?
Well, the bottom line is it's not really just only cost. It's your choice of lifestyle. Whether you choose to have something not removable. I had a 92-year-old came to me, and she wore a denture all her life, and all of a sudden she just don't want anything to be taken out by a young intern.
Oh, yeah.
So she turned around and got all the implants in her mouth, so none of her teeth will come out. So, like I said, it's a life choice. It's choice between financial means and lifestyle. Now, which one is better? Of course, something that is natural to you is always the best. So I urge everybody to keep their teeth as long as possible. And when you lose your teeth, maybe you want to consider 1 or 2 implants as replacement. That might be a more optimal choice. Denture is probably a last resort because why? Nothing feels right. It's just a piece of plastic in your mouth, and chewing function. You could get by, you could get nutrition, but it's a lot of time is not most people's, I would say, lifestyle choice.
We're talking to Dr. David Jin, a beautiful Smile Dentistry office in Fort Lee, New Jersey, here on iHeart Radio's CEO Unplugged. And another service that you provide is the Invisalign. I guess that's for the straightened teeth.
Yes.
And that's pretty amazing. I mean, when my kids always had to have the braces. But tell us what Invisalign does and who benefits from it.
Well, Invisalign, everybody could benefit from Invisalign as long as you think you have teeth that is not straight, and you could get benefit from better aesthetics, better functions. But the true thing about Invisalign versus brackets, the brackets, it has wires. It has, like I said, brackets. And these are things that accumulate plaque, bacteria, and everything. There's a recent study just published not too long ago where it shows that Invisalign is far superior than any of the brackets. Why? Because it promotes better oral health. Now, if you wear Invisalign, you have to brush your teeth at least 2 to 3 times a day. Every time after you eat, you have to brush your teeth. So you want to be a healthier, cleaner patient after all. On top of that, the best thing about Invisalign is you get to see what you're going to end up with. You're going to go from day 1 to day N or day Z, and you know exactly how you're going to turn out to be. No other braces system ever able to afford that to you. They cannot predict that nature.
One of the other things that impresses me about dentistry these days is the sophistication of toothbrushes and all the paraphernalia that's available to people to keep their teeth clean and healthy.
Yes.
Outside the dentist office.
Oh, absolutely. I mean, we don't see our patient 24/7, and I don't think anybody could afford us to. With that said, the most important thing, remember what I was talking about, the machine. The most important thing to a machine is maintenance. How well you take care of that machine is how much miles you could go and get out of it. So the better you're able to keep your teeth clean. And yes, electronics do work much better than human hands because our hands cannot vibrate anywhere near 200,000 cycles a minute.
And in terms of the flossing advice, the flossing and brushing, I mean, is it still the same? Has that advice kind of advanced or become a little more sophisticated?
Well, I mean, electronic toothbrush actually makes a lot of improvements so that a lot of folks may want to say, hey, you know what, I could skip the flossing and this and that. Truth of the matter is the more you do to clean your teeth, the better you will be. So everything is additive. Everything, if you add one additional regimen to another, you just will be that much healthier and cleaner. So yes, flossing is definitely recommended.
In looking over your brochure from A Beautiful Smile Dentistry in Fort Lee, I noticed that you treat snoring issues.
Yes. Oh my God, this is the best, newest, and
Tell
best.
us about that.
Well, I mean, it's all about laser. Okay, we talk about a lot of female patients know that laser could tighten your skin, tighten everything. Well, just imagine if we could tighten the back of your throat. That means the muscle in the back of your throat gets a little bit thinner, so there's more air volume able to go through. So with that said, what is snoring? Snoring is the loose tissue in the back of your throat. They're creating vibration as air goes through. As air goes through these passages, the vibration becomes snore. So if you could minimize those soft tissue, you actually become a less of a snorer.
But you're not dealing with teeth there, are you?
No,
Well,
but
it's the mouth, I suppose, right? It's
you
all in the same
understand,
spot.
We are the doctor of the oral cavity. After all, we still have to play doctor.
What do you find most challenging about your business these days?
The most challenging thing I have to say is really get to know your patient. The bottom line is you're still treating a human being, and you're still treating somebody, that will actually talk back to you, and they'll comment on what you're doing. And your ideology may not be the same as theirs. And the most difficult thing I find is really sit down and talk to them and present them with various treatment plans and say, I think this is what's good for you. This is what's best for you. But then if they take a different path, you got to be ready for that. Talk about implants, talk about dentures. Well, if the person cannot afford implants, as a doctor, you still have to fix that person. You can't just say, well, it's either implant or the highway.
Mm-hmm.
Well, I'm from old school. There's a lot of highway out there before, and it's not implant. So you got to figure out a way to say, hey, what can I do to make patient better? And I think that is a lot of time the biggest challenge, to turn around and to take a step back and say, ideal dentistry is for dental school. Ideal dentistry need to be for that particular person and apply to that person when that person like it and able to use it.
All right. So how do you deal with your patient? Looks at his calendar's up. I got a dentist appointment coming up next week. I got to change it. I got to delay it. Let me put that off.
Oh, well, here's the thing. I'm fortunate enough that I have Helen in my office. She's like the mother of the whole. Remember, I tell everybody, every patient is like a family member. So she's like the mother of this big, huge family. When mother say you got to come in, most of my patients will come in. So technically, I really don't have to deal with that. But the truth of the matter is, yes, there are challenging patients like that and who resist in seeing us. It's like, when you bring a car to an auto shop and you say, hey, leave the hood closed and don't see anything underneath. Just tell me I'm fine. It's challenging.
Tell us a little bit about your offices in Fort Lee. I mean, what people would see if they came in for a consultation, and what you offer.
Well, my office in Fort Lee is going through a $1.8 million renovation. And basically, I decided about 5 years ago, I decided to bring the latest and the best. Not that we were not behind in any of the technology curves. We always have the newest and best equipments. But with that said, the office been there since the 1960s, and it's due for a facelift. So we did that, and in addition to that, we added on various equipments that allow us to better dentistry, such as 3D X-rays. In addition to that, we're investigating, and we're actually going to bring on board a new dental record machine. And basically what it does, it's amazing. It's a tool that takes pictures of your teeth, and it records it. It records it in three dimensions. And in addition to that, next year when you come in, I could show the same recording and record it again and see what is the difference, what disease, what decay, what abrasion. See, a lot of time I tell patients, you grind your teeth. They're like, no, I don't. I have no proof. I can say, well, you got these pits here and there. And they're like, well, it's always been there. Well, has it got deeper? Has it changed? I have no way of proving that. Now, this new machine that we're going to bring on probably within a month or so, it will record that from a year ago. Now, just imagine I have 10-year records of a patient, and I can show them successively. Every year is getting worse. And that, to a certain extent, maybe one of them will say, help me. And that's my job. My job is to help them.
Well, it's better than the X-rays, because I can't understand what you put them up there and right.
Well, X-rays we're not Superman. So X-rays really for us to really dive in to see what is the substructure,
right?
And that's the purpose of it. And that's where the 3D X-ray actually comes in.
Mm-hmm. Dr. David Jin, it's a pleasure. Why don't you tell our listeners where they can get some information on you and your dental offices in Fort Lee?
Sure. I'm Dr. David Jin. My Fort Lee office is 1315 Anderson Avenue in Fort Lee, New Jersey, 07024. The office name is called Beautiful Smile Dentistry. You can send us email at info@absdentistry.com. It's info at Alpha Bravo Sierra Dentistry.com. And you can look on our website. It's www.abeautifulsmiledentistry.com.
Our guest on CEO Unplugged, Dr. David Jin. Thank you very much and best of luck. For iHeart Radio CEO Unplugged, I'm Joe Bartlett.